Good day, Miss. My name is Rachel Nueva Mahinay. I am from BIS and Mercer, and today I will be preparing the oral medication. So, what is oral medication? Oral medication, it is the giving of medication to be swallowed through the mouth. For the assessment, assess the appropriateness of the drug for the patient. Number 2, review medical history, allergy assessment, and laboratory data that may influence drug administration. For number 3, assess the patient's ability to swallow medications. Number 4, verify patient name, dose, route, and time of administration. For number 5, assess the patient's knowledge of medication and procedure. Number 6, if the medication may affect the patient's vital signs, assess them before administration. Number 7, if the medication, if for pain relief, assess the patient's pain level before and after administration. For the objectives, to ensure the patient metabolizes medication without feeling of nausea or vomiting. Number 2, to offer the most common, easiest, and least expensive route of administering medication. Lastly, to provide a sustained drug action and increased absorption of time. The special consideration, monitor reaction of the patient to the medication administered and document. 1. Gather equipment. Check medication order against the original position order. According to agency policy, clarify and inconsistencies. Check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the action, special nursing consideration, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. Rationally, this knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and also can be used to educate the patient about the medications. 3. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medication to the patient's bedside carefully and keep the medication in sight at all times. Careful handling and close observation prevent accidental deliberate disarrangements of medications. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and that helps prevent errors. Explain procedure to the patient. This is to gain cooperation and to allay anxiety. Next, assist the patient to an upright or lateral position. Rationally, swallowing is facilitated by proper positioning. An upright or a side-lying position protects the patient from aspiration. Next, administer medications. Offer water or other permitted fluids with pills, capsules, tablets, and some liquid medication. These liquids must facilitate swallowing of solid drugs. Some liquid drugs are intended to adhere to the pharyngeal area, in which case liquid is not offered with the medication. B. Ask whether the patient prefers to take the medication by hand or in cup. This encourages the patient's participation in taking the medications. Next, remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside. Unless the nurse has seen the patient swallow the drug cannot be recorded as administered. The patient's chart is a legal record. Only with a physician order can medication be left in the bedside. Next, perform hand hygiene. Hand hygiene prevents spread microorganisms. Leave the patient in a comfortable position. Lastly, check on the patient within 30 minutes or time appropriate for drugs to verify response to medication. Rationally, this provides the opportunity for further documentation and additional assessment of effectiveness of pain relief and adverse effects of medications. For recording and charting, date and time of administration, name of drug, dosage, amount and frequency, route of administration, signature of nurse administering the drug. Thank you and God bless.